What is certain is that almost everyone has had a headache, and women are more often affected than men. 4 million Americans are familiar with daily chronic headaches or even severe migraines and simply cannot find peace. The feeling of hammering, drilling, knocking, and the threat of bursting the head is extremely stressful for those affected. They can accompany other physical illnesses, such as primary meningitis. Patients should always have this clarified by a doctor or alternative practitioner. In some cases, headaches are more psychological than physical. For example, headache attacks often occur as a result of or accompanied by stress, anxiety, and panic. In the civilized world, the increasing exposure to permanent noise or radiation-polluted surroundings, for example at the workplace, should not be ignored in headache. With any form of headache, those affected should keep a headache diary and document the intensity and the situation when the pain occurred. For a correct diagnosis, a specialist examination is always recommended, ruling out other neurological diseases. A headache test or literary headache guide can help distinguish primary from secondary headaches or cluster headaches from migraines. You can get to the bottom causes of migraines if you take a closer look at the patient's lifestyle, among other things. Affected migraineurs are unable to work in this state, withdraw, and require darkness and absolute rest if they suffer acutely from migraines. With the pain relievers analgesics, limited relief is achieved temporarily for tension headaches. The types of headache are ultimately as diverse as the causes that trigger headaches, and so is the way of treatment. For headaches, pain relievers such as ibuprofen, paracetamol, acetylsalicylic acid, and other prescription migraine drugs can help. However, not every patient can tolerate the permanent use of medication, which can also be addictive and cause headaches when they are stopped. So what do you do with regular tension headaches, besides constantly collecting prescriptions for suppressing the pain with medication? A regular daily routine, a healthy lifestyle, a healthy diet, relaxation procedures, and good sleep help prevent tension headaches. The method of hypnotherapy can demonstrate success in the field of headaches and is considered an advantageous alternative. If your headache is triggered by excessive stress, self-hypnosis, for example, can help you relax immediately and deal with challenging situations in a much more relaxed manner. This encourages the patient to take an active role in self-treatment, activation of self-healing powers. The results of a study suggest that hypnosis is a very suitable therapy, especially in the treatment of chronic migraine headaches with frequent attack frequencies. In general, it is certainly advisable to adopt a calmer way of working and living in order not to constantly end up in stressful situations. This is often easier said than done. Because behind your extremely high demands on yourself and others there can be deeper psychological causes. For example, if you have or had the feeling that you can never please your parents or your partner. The emotional causes of your headache, such as a previous trauma, can be quickly found out and effectively resolved by means of hypnoanalysis in deep hypnosis.